Hello, Dr. Dan Luxka here from Instacare Physical Therapy. I will guide you through this educational series on low back pain. Just a reminder, this is not to be used for medical advice. If you are experiencing low back pain, you should consult with your physical therapist or primary care physician. Today, we will start our educational series on the causes of low back pain. But first, a little background on back pain in the U.S. If you have lower back pain, you are not alone. About 80% of adults experience low back pain at some point in their lifetime. It is the most common cause of job-related disability, and it has been reported that employees with back pain are absent 4 more days per year than employees without back pain. About 30% of the time, you will have a reoccurrence of your low back pain within the next 6 months. When someone injures their low back, it can range from a dull, constant ache to a sudden sharp pain. Sometimes the pain starts immediately after a fall or by lifting something too heavy, or it can develop over time from poor posture and bad mechanics during certain movements. The majority of acute low back pain is caused by the musculoskeletal system, which means there is an issue with the muscles, joints, or nerves and how they move together. There are certain risk factors that increase your chances of having low back pain, which include a sedentary lifestyle, excessive weight, poor posture during pregnancy, smoking, occupational hazards, genetics, and pre-existing mental health conditions such as anxiety or depression, which can influence how closely someone focuses on their pain and affects their perceived severity of it. Now, let's take a look at the anatomy of the spine. Your vertebral column, or spine, is made up of 33 vertebrae or bones with various sections. Your low back section is referred to as your lumbar spine. The 5 bones in your lumbar spine are referred to as L1, L2, L3, L4, and L5 from top to bottom. Let's take a closer look at the individual segments of the lumbar spine. Note between the bones is the disc. The disc acts like a shock absorber that cushions the bones as the body moves. It has thick ligaments surrounding it to give extra stability. The lumbar spine surrounds the spinal cord to provide protection. Coming out of the right and left side of the spinal cord are nerve roots, which transfers nerve signals to and from the lower half of the body. These joints in your back get nutrition from clear synovial joint fluid moving into and out of the joint. This synovial fluid circulates best during exercise, which is why it is so important to get up and move frequently throughout your day. Now, let's review the most common causes of low back pain, which include back sprains and strains, disc degeneration, herniated or bulging discs, radiculopathy or sciatica, trauma, spinal stenosis, and referred low back pain. Back sprains and strains are the most common causes for acute low back pain. They can result from lifting something with poor technique, lifting something that's too heavy, or overstretching the back. Such movements may also trigger spasms in back muscles. A sprain refers to the ligaments being injured, while a strain refers to the muscles being injured. Disc degeneration occurs when the usually plump discs lose their height as a normal process of aging. As the discs deteriorate, they lose their cushioning ability and overall ability to move, resulting in pain. A herniated or bulging disc can occur when the intervertebral discs become compressed and bulge outward, causing compression on a nerve, which can result in lower back pain. A radiculopathy injury is a condition caused by a compression to the spinal nerve root. Pressure on the nerve root results in pain, numbness, or a tingling sensation that travels or radiates to other areas of the body where that nerve travels to. The most common radicular condition is called sciatica, which occurs when the sciatic nerve is compressed. The sciatic nerve is a large nerve that travels down the buttocks, down the back of the thigh, and into the lower leg and foot. A traumatic injury can occur from a car accident, impact during sports, or a fall, and can injure tendons, ligaments, muscles, or bones, resulting in low back pain. Spinal stenosis is a narrowing of the spinal column that puts pressure on the spinal cord and nerves, commonly caused by arthritis. This narrowing can cause pain or numbness with walking. And this last one is also one of the least common ones, called referred low back pain. It is not an actual injury or issue with the spine itself, but with nearby organs, referring pain to the low back region. An example is prostate cancer, which sometimes refers pain to the low back region. So the individual may feel pain in their lower back, yet there is no issue with the low back itself. Not only are there many different causes of low back pain, but it could also reduce your quality of life in many different ways. It could affect your ability to work, keep you from exercising, have you miss out on social events, lead to depression, lead you to long-term use of pain medications, and be very costly in healthcare expenses. All of these reasons are why it is so important to understand low back pain so you can best manage it and live your most active and healthy life. Let's make sure to end this on a good note. There is good news. 90% of acute low back pain episodes resolve within 6 weeks regardless of treatment. Even if you do nothing, you will most likely get better. However, by seeing a medical professional, you may be able to significantly speed it up and reduce the risk of it reoccurring. Here, I put together the key takeaways from this video. First, about 80% of adults will experience low back pain at some point in their lifetime. Next, your lumbar spine is comprised of 5 vertebrae or bones, L1 through L5. Your back is made to move. Movement helps to provide nutrition to your spine. There are many different causes and risk factors for low back pain. 90% of people with low back pain will have it resolve within 6 weeks regardless of treatment, although a healthcare professional can help speed it up and reduce the risk of it reoccurring. That's all, folks. Thanks for listening, and we hope you enjoyed this video on low back pain.